We are back, dear viewers, and with our first and interesting guest, Dr. Dragana Pivac, a dermatologist which is an expert in skin care. She will express her experience in this very important medical branch which is related to everyone's body. So let's all welcome our and your guest in the studio, Dr. Dragana. Good morning, Dr.
Good morning. Good morning.
And it's really an honor to have you here in Good Morning Kuwait program.
Thank you for
coming. So, first of all, Dr. Dragana, you are from Serbia, old Yugoslavia.
Yes, yes.
And definitely, we were chatting to the viewers. Definitely, Yugoslavia had a very strong and interesting national soccer team.
Yes.
Anyway, let's move on to the medical part now.
Yes.
And tell us about, you know, your basically which part of the body you will focus on today.
Today, let's talk about face mostly.
Face, yeah.
Yes, this is the most
skin.
important. Yes.
So
face or facial skin. Yeah.
So you graduated from where?
From Serbia.
From Serbia.
Yeah, from
and,
Serbia.
And
my
specialty
specialty is the dermatology and sexually transmitted diseases. This is my specialty.
Tell us about dark spots on the face.
Dark spots.
They are, these little, they are not pimples, but I don't know. It's like somebody put a dot on.
Yes,
on your
yes,
face.
dots on the skin everywhere, but especially on the face.
Yeah.
It is very good topic to talk today.
And it increases by the age also.
Yes.
By aging. Yeah.
By age and of course by sun.
Yeah.
There are many dark spots. They can be congenital, they can be hormonal, but mostly dark spots are here, especially in Gulf countries. They are like one of the biggest problems on the skin because of the strong sun.
Okay.
And dark spots actually are defense of skin from everything bad. The pigment is the defense of the skin. So if you have any scratch, any wound, any burn on the skin, after exposing to the sun, you will have dark spot.
Okay.
So this is the problem because there are many sunny days in here.
In Kuwait.
So and if you are not protected properly, and usually you are not, because some protection should be every 2 hours. Nobody is doing proper protection. Of course, during the time you will have more and more these dark spots.
During the years, let's say.
Yes, and the biggest problem also is that improper treatment of this, because many people they don't treat themselves properly. They use some home care which is not good, or some cheap salons, and after that they are not instructed well what to do, and they have more dark spots.
So tell me, what is the best treatment in your mind?
There are many treatments. There is no miraculous treatment. There is no one magical medicine. It is very difficult treatment, one of the most difficult situations in dermatology generally. But if you do a proper combination of topical treatments, creams and injections, and if you do it, and peelings, chemical or herbal peelings, laser peelings, there are different types. If you do a proper combination of these treatments, you will have good results. But what is important, patient needs to know that it will last for months. The treatment can last for months. So it is, and even after the best treatment, maybe if it is very deep pigmentation, it will not be removed completely. It will be just diminished. So it is important not to give up, and it is important not to treat yourself somewhere else, to search for some special medicine, because there's
none. Yeah. So what you're saying, you try to take care, your skin along the time, along the year.
Yeah.
Not to neglect, your skin. You try to take care. Besides, go to the main medical centers. Don't go to cheap salons.
Yes,
or,
yes.
creeps.
Because dermatology, you can find advice from everybody. Everybody knows dermatology.
Especially women.
Yes.
Is that true?
Everybody knows, yes.
Anyway, because honestly, I know women are, obsessed with their skin. Definitely, they want to look good, to the public. And that's correct and okay. I mean, this is their rights. But what I'm saying, why the pigments, or they come on the sides sometimes, there are like, you see,
yes, this is
why they come on the side. They don't come on the face, like
they come, it depends. Yes, because of the exposure. They come on the middle, on the face in some cases, in some hormonal
mostly
cases,
on the sides.
but mostly yes, for these pigmentations that they are from sun and from most usual pigmentations are on the side.
Good. So I heard this term like rejuvenation of the face.
Okay.
So what's this all about?
Good topics also. Pigmentation was good because now is the time for treatment, because now sun is going it's not so strong, so we can start with peelings. So it is good time to start treating your dark spots.
Because what comes to the mind, when you say rejuvenation, it's like, am I like changing my face?
No,
some people think
this is making yourself to have a more youthful appearance.
Okay.
So this is not that you will from 50 become 20. It will not happen, but more youthful appearance. And not just that, it is really, it means you can have youthful appearance if you put some fillers or Botox in your face, but it is not rejuvenation. Rejuvenation is when your skin becomes more nourished and with better quality.
Natural, by natural resources. Like
the
substance.
best, there are, last time I was talking about skin boosters, it is also for boosting of production of skin collagen. But this is one of the methods for skin rejuvenation. But now I want to talk more about radiofrequency needling. It is at the moment the best method for rejuvenation. They admitted as a accepted as a best method in the world. Radiofrequency needling. There are many machines in the market.
So basically hitting your skin with
needles, yes. So you have some like 24 or 64 needles, it depends on the hand piece, yes, and you put needles in the skin, and needles emit radio frequency inside the
what
the
does
skin.
it do, this radio frequency?
So this is combination of needling, which is good because need a lot of needles in the skin. The skin recognizes it as a wound, so it makes new cells to treat that to treat the wound. And radio frequency also stimulates skin to produce new collagen, elastin, so new skin. And so the final result will be like diminishing of skin pores, diminishing of skin lines, tightening of the skin. So it will be youthful, more youthful appearance.
For example, Michael Jackson. You remember Michael Jackson?
Yes.
Okay. What did he do for his skin?
To be honest, nobody knows exactly how he, from black skin he became white. Nobody knows.
We're talking about the 80s, Dr. Grana.
Yeah.
So which means, he had maybe the technology back then, the medical technology, you know, to do that, and that was really amazing. From black
yes,
to
yes.
white.
Nobody knows exactly. He told that he had vitiligo, you know, but it is not possible to have vitiligo on full body and to have dark hair at the same moment.
It doesn't
so
make sense.
Actually, nobody knows. Probably there were some unapproved methods. So for sure.
So you're saying by having this latest technology or method is by using the needles with the radio frequency and that. If I ask you, because a lot of people wonder, this collagen comes from where? I mean, what should we eat to get that collagen?
Okay, they have that actually collagen is in the bones and the other structures from around the bones, ligaments of the animals, but it will not help, you know.
Absolutely.
If you want to boost the collagen in the skin, you should take collagen in liquid collagen, not in tablets.
Injected?
Liquid. No, liquid and drink.
Really?
Yes. And there are collagens you can in different concentrations, and you can take. And I recommend to my patients to use it. So.
And how about the treatment of acne?
About acne, yes. Acne, okay, you know that acne are very common disease everywhere.
Can you explain it, because for our viewers, what is the acne precisely?
Acne, this is actually acne are a state of the skin. It's not the classical disease.
Okay.
Some of the oily types of skin,
my skin is oily.
They have this is very complicated mechanism, you know. So the skin is oily, that there are higher production of sebum, and some bacteria also there on the skin. So when there's higher production of sebum, there is higher production of the extra dead cells, because oil skins they have better higher metabolism, so they make a lot of dead cells. So these dead cells clog these glands which produce sebum, and with this bacteria around, they make like inflammation, they make pus, and actually this is acne. So it is, and it is. There are many treatment modalities for acne.
And what do you recommend?
There is no one special treatment. You have treatment, oral treatment with some different types of tablets. It depends on the case. Also, there is topical treatment, so you use different lotions, creams, peelings, scrubs. I'm talking about home care. This is what I told now, and the other treatment is also in the clinic, so you can do different meso injections, you can do different types of peelings under supervision of dermatologist, of course. And all of this, when you use it properly under supervision of dermatologist, long enough, you will have good results, very good. You can keep acne under control. You can't
just make it disappear.
And your skin will become very bright and nice. It will not happen, but it can be under control, and it can be patients can be very happy, but they should be patient. Not give up. But acne scars,
do like that,
our patients are really many times they have unrealistic expectations.
So tell me,
the
what's the most common side effect of these skin products?
skin product, you mean skin products like for every day, or you mean like skin medicines?
I mean like the everyday thing.
Okay, skin products for every day, they are very safe. Only what can be unexpected and you can't predict it, it is allergy on any ingredient inside.
Any ingredient.
So you can't predict it.
You have to know your skin more.
Yes, but about this, this is the negative effect allergy. This is what we can predict. But the other negative effects are not from skin products itself. It is from misusage of the skin product. So, for example, if you use a skin product which is not appropriate for your skin type, this is important. So you use, for example, you have oily skin and use skin product which is for dry skin, or vice versa.
Okay.
So that in that situation you can make a problem to your skin. But skin products are very safe.
Like I have this, I had this problem back in teenage time.
Okay.
Okay. I have an oily skin, and there is a lot of people with oily skin. And you know, somebody has an oily skin. If he doesn't take a shower twice a day, let's say maybe, or once a day, okay, he will have oily hair.
Yes, this is usually connected, oily skin, oily hair.
Okay, so, and you know, a lot of people lose their hair, you know, during doing a lot of showers and, you know, shampoos and stuff like that.
Yes.
So if he doesn't do it from one side, he will have an oily hair and looks really ugly. And if he does it, you know, then he will expose, you know, he's exposed to lose his hair. So
yes.
what's
the solution?
Solution for that? What do you do?
Solution is, I will tell you what I recommend. If you don't have any problem. First,
and see, this is for guys. It's okay.
Yeah.
But girls, the problem.
Yes, they have, of course, the same problem. Yeah. If you don't have any problem, if your skin or your hair is normal, if you don't have any problem, you can use any cosmetics.
Exactly.
But if you feel that your skin is very oily or your hair is very oily, don't treat yourself by yourself. You go to dermatologist and you will get proper treatment, because there are many products especially formulated medical products for oily skin, for oily hair. Not just shampoos, some special lotions, you know, some mesotherapy treatment.
Scrubs.
Not scrubs for hair.
I mean for skin.
But for skin, yes, of course. Yeah.
Scrubs are good, huh?
Yeah, for oily skin especially, for every type, but especially for oily, you know. And for oily skin, you should use it 2 times per week at home.
Okay.
And of course, good, like my advice is, if you every person should go at least once per month to good clinic to do facial, hydrofacial or deep cleaning or whatever. It depends accordingly
unfortunately,
to the skin.
We are illiterate in dermatology. Honestly, you know, exactly. You just said something very important now. You know, at least once or twice a month we have to go for a clinic to do the facial. Just facials.
And if something is wrong, if there is something, so just facial to remove dead cells, to allow skin to breathe. But if you have any problem, dermatologist in the clinic will notice it and he will give you the proper
When you
treatment.
say allow the skin to breathe, when I play football or basketball or paddle or whatever, any sports, you know, and then I sweat a lot, you know, and then I take a shower, wouldn't that precisely making my skin breathe?
Yes, of course, because
this is very healthy.
Yes, of course, you fasten metabolism in your skin, in your body and in your skin.
The sweat is out.
Yes, it is good. It is good. And if you do some good scrub, yes, it is invigorating.
Nice,
so
nice.
Of course, it's good.
So, do you recommend home care of skin?
Home care, I just started to say. So, first every month dermatologist, I mean clinic for facial. And of course if there is any problem it will be treated. And home care also, you need to know the type of your skin. Also, if you don't know, actually the best is to from the age of 16 to start, especially women, to go to dermatologist, to check your skin, to know that he will determine the type of the skin.
The good judgment.
Yes, and you will use cosmetics accordingly. So no need for some special medical cosmetics or the most expensive cosmetics, but you will use what is important from from morning. Washing, good facial wash. After that, toner. After that, sunblock. For young people. For people after 30, washing, toning, serum, and sunblock. And serum for
toning. What do you mean?
Toning, it is toner with liquid. Yes,
it's a treatment. It's like a substance.
Okay. It is liquid, and it. After washing,
again,
you know,
so
it's
again, for 16, for my kids.
Okay.
You know? Yeah.
Washing. After that, toner. And after that, sunblock for morning. Yeah. For night, washing, toner. And night cream.
Night cream.
Why
there is
toner?
A night
toner
cream
is
before you go to bed.
Of course. Of course.
We are really
yes, it is important.
You know, we are poor scientifically in that, honestly.
It is important to start on time.
I don't know a man, you know, with put a cream.
Men after 30. Before 30, no need to start, but they need to use at least this. The most important is skin to be clean, and also because water here in Kuwait is not good. It's very hard, so that's why toner is important.
Okay.
So either toner or some of thermal waters that you can find in any pharmacy. So just to change the pH of the skin, so the acidity of the skin. So that's why toner is very important. So washing for older, washing, toner, serum, and skin. And cream. Why serum? Serum with vitamins, with hyaluronic acid.
So
you know.
what's the best type of a skin?
The best type.
Honestly,
there is.
I mean,
there is no the best.
No best.
Why? Because oily skins are not prone for to make wrinkles. But oily skin is very difficult to control. All day you are shining. But dry skin is easier, but it's wrinkled. Yes, and so there is no.
So there are some negatives and positives.
That's why you need to take care.
Because we are, Dr. Dragana, we are almost done. Okay. So your advice about the hair and skin care medical?
My advice is to start, as I told, to start to home care early. Don't go to bed without makeup removal. It is very important. And as I told, washing, toning, cream. This is always. Sunblock as a must. Only during the winter period, of course, you no need to use sunblock. And don't do anything just that you heard from the neighbor or from your cousin, or you found out on internet.
Google,
because on
whatever,
internet, yes, you can find.
Thank you.
This is the most important. And if you have any problem, don't hesitate. Yes, to go to dermatologist.
Dr. Dragana, Pivac, dermatology and dermatologist. Thank you very much, for being with us.
Thank you for calling me.
Great thanks. You enlightened us and our viewers. Thank you. Hope to see you more, in Kuwait TV.
Thank you.
And KTV too. Thank you.
Thank you.
Dear viewers, I guess that's it. And after the break, we'll go for Abdulaziz.